Hi everyone, welcome to Center of Balance Live. I'm Sinanpoa from Center of Balance, the acupuncturist. Setting up my live in here. So today's topic is about fibroids again. The topic is actually who is at risk for fibroids. So who is at risk for fibroids? Right? This is the topic we're going to talk about today. So I have to share in the Chinese platform, so I have to talk something in Chinese. 大家好，我是小花医师。那今天呢，这个早上啊，在我这个时间是早上。那我们要讲的是英文的主题啊，关于这个子宫肌瘤 ，Who is at risk for fibroids? Hi Veronica, how are you? Thank you for supporting. Now, yeah, it's Sunday today. Hi Eric, how are you? It's great to see you. So yeah, when you came up here and you see me and I'm live, join the live, and please say hello. Hello. So hello. Then give a thumbs up. Whether you're in Facebook, Instagram, or YouTube, please give me a thumbs up and share this live video on your Facebook, on your Instagram, please. Thank you. Now, yes, I'm going to temple later. Yes, that's right. Yeah, every Sunday. Good memory. Thank you. All right. Now, let's get into it. Who is at risk for fibroids? So, women are at greater risk for developing fibroids if they have one or more of the following risk factors. Right. Now we talk about I share to you about what causes fibroids, right? The main thing is the hormone, right? The hormone out of balance, and the female hormone, which is estrogen and progesterone, right? Those two are the main one, right? Those are the main one. And with pregnancy women, and those are the main hormones increase in pregnancy, right? So the first women who are at risk for developing fibroids is pregnancy. Yeah, pregnancy. Well, although I want to tell you that pregnancy is not a disease, you know, it's just a normal cycle for women when they get pregnant, right? But they're in high risk for fibroids, right? Because of the estrogen and progesterone increase in the body, so it will stimulate the uterine cell to grow and become fibroid. Then that's possible. Right? One of my patients years ago, and they came to me because of this. She didn't realize she had fibroids, to be honest. She didn't realize this before pregnant. Then since she got pregnant, and then she started get spotting. Then we did some moxibustion and acupuncture, right, for her. And then she had skin, and she found out that she had fibroids. And keep tracking it. Yeah, within a month, the fibroids grow pretty big. And the fibroid position that growth is actually in the way of the baby that's going to come out, in the vagina area. So it grow. So they both grow together, so it becomes a risk for the baby. So really, the fibroid, not everyone get it. When you get it, it doesn't really matter sometimes because there's no symptoms. It doesn't cause any problem for you. That in this kind of case, it doesn't matter if it doesn't make you sick, doesn't give you any symptoms, and that's fine. But for this patient, that it is a risk for the baby, so they have to do something. In the end, she get C-sections to give birth and to try to save the baby. You see, so anything like in Chinese medicine, I won't say that. Wow, I can treat it. I'll just give you needle. Blah, blah, blah. Yes, we can give the needles, but we're not sure whether we will save the baby or not. It's not about treating the fibroid now. It's about saving the baby. Does it make sense to you? Okay. Now, woman who, if you don't have period, you don't have the risk. So whoever got period, like it used to be 14 in a girl, a teenager, 14, they get period, right? 14. But what happened right now? You get period much earlier. My patient's daughter get period at 8 years old. That's far early. It's more common in 10 and 11 now. 10 or 11. Okay. So that's in our diet too, to get period that early. So as soon as you get period, then you have the chance to develop fibroid. Okay. And of course, more people get it above in the age of 30 or older, right? There's another one. And family history, a family history of fibroids. Your mom, your grandma, your sister, or it doesn't go to your sister-in-law, okay? The mom, your sisters, your grandma, your cousin, when they have fibroid, then that's called a family history. So you're much easier to end up with fibroids. Again, we talk about the family history is more on your lifestyle and diet. Okay. And funny thing in here is African American, 50 to 80% chance to develop fibroids. So more than European. So we need to know this, okay? Well, we haven't got African American much in New Zealand, so I don't know about this. I haven't seen anyone about this, but I do see African students in here who came to see me about fibroids. Yeah, about fibroid students. From African. Okay, so African, and the others. So you have pregnancy, family history, age of 30 or older, African American. The other one is a high body weight. Which is obesity, right? A high body weight. Hi, Happy Day, how are you? I'm good this morning, thank you. Okay, high body weight. I keep going to. Sorry, it's not connecting properly. We have trouble connecting to the live video. It's the connection's not good. Just fixing this Instagram. I didn't realize it didn't connect properly. Central, how are you? UK, that's great. Okay. Thank you for saying hi, and please give a thumbs up and share my live video if that's possible for you. Thank you. Alright, I'm going to share here. Yes, okay. That's good. So why we just went through PCOS, right? And PCOS hormone out of balance too. Okay. In the PCOS is the male hormone increase and female hormone decrease, right? Whether you still remember that or not. And fibroid is female hormone increase and male hormone decrease, right? The female hormone too much in estrogen and fibroid. And PCOS is the male hormone increase and female decrease. But have you seen anyone who developed PCOS as well as fibroid? Yes. Yes, I've seen that. I've seen that fibroid as well as cysts in the ovaries. And that doesn't make sense now, right? Because one of the causing fibroid is the female hormone high increase, and for the PCOS is the male hormone increase. So why some people would develop both? That's a question for you. That's because both of them are most of the case, in this case, is they're in a heavy weight. A heavy weight, it became a problem, a real problem, because when you develop heavy weight, it actually causing hormone imbalance, which mean you have irregular period. It may cause irregular period, and the hormone irregular. And hormone irregular out of balance means that it may produce a lot of female hormone in a while, sometimes. Then in other time it did the opposite. The male hormone produce a lot. Right? So male and female hormone out of balance. So we need to understand here. That is why they end up with fibroids and cysts, ovarian cysts. So very different, isn't it? Two different things causing from hormone, and the hormones should be opposite cause of two different things, but actually end up one body. Yeah, that's because when they're fat and hormone out of balance, sometimes this one's higher, sometimes the other one's higher, end up with fibroid and cysts. Okay, now I had a patient yesterday, new patient, my last patient in the end of the day, and she came in for shoulder pain. Then she actually have cysts in the kidney, diagnosed from last year. Had a scan last year because might be UTI, but get a check, no UTI, and they had a scan and found out that wow, it's actually had a cyst in the left kidney. A cyst in the left kidney, 27 mm, something like that. Right. So what this patient, I'll share something about her with you. I can't say her name, but it's just some symptom. She did a great thing already. She told me that she lost weight for 10 kg. I said, how do you do that? How do you manage that? I want to know. I always want to know about how they losing weight. They said, well, Asian food. He said, well, Asian food? It doesn't make sense to me now. Right? China food. It does make sense. Exercise and China food, not European food. That's what she said. No junk food. No preservative food. avoid all this and cook. She lists down all the things that she eat. Pretty healthy when I look at it. A lot of them are plant-based. I haven't go to the diet and asked properly whether she was on any dairy or animal fat and protein yet. But she said, well, Chinese food. But with Chinese food, you stir fry and you cook it yourself. It's much more healthier, much more nature food, right? But one thing is Chinese people, we eat a lot of carbohydrate, and you want to slim down in carbohydrates. One of the things that you shouldn't base on just carbohydrates. You have a lot of veggie. There's one thing to get you slim. Okay, and the funny thing is, the Chinese people right now, you see a lot of people in large fat. Why is that? Because they love fast food. They love European food. We're doing the opposite, aren't we? Yeah. So I want to tell you that what my patient using 2 or 3 months probably lost 10 kg, and she felt much better in many ways. Okay, already before treatment. And of course she had a kidney cyst, and I was saying her, I haven't got enough evidence since she changed the diet, because there's no symptoms apart from just recently a bit of pain in the kidney area. Otherwise there is no symptom. That's why the doctor, the specialist, didn't want to see her, because there is no symptom for causing from kidney cyst. Then I want to know, it's been a year already, and she suggested she went in and do another ultrasound scan and see whether the kidney cyst is getting is increasing or it actually is decreasing. If it's increasing, then we need to do further investigation for, like, maybe do some biopsy on find out what actually it is. And if it's decreasing or it's gone, that's great. That is totally harmful to diet, because she changed her diet, she lost 10 kg. But we don't know yet, so we say, well, let's just make some plan to treat your shoulder and put aside of the kidney cyst here, not until you get your ultrasound report back to me. Does it make sense? Okay. Now, so patient, this is the main complaint of the shoulder pain in kidney cyst. And that's back to fibroids. So with fibroids, you see one of the factor people that in risk is because they are fat. Okay, they so changing this is through changing diet, following with diet. You know, don't want to go to just exercise. People say, well, exercise, you should exercise. Not everyone can exercise, but you are what you eat. Okay, you are what you eat. That's important to know. So what is the side of the fibroid can be advised to go for operation. Really, when it comes to fibroid, really want to go operation, it's not about just the size. It's about the age as well. And it's about whether it's grow or not. You can't just say look at the size, oh, the size is so big, and then whether it causes any symptom. If the fibroid is big, tennis elbow big, okay, and if you're on the age of 40 and it doesn't cause any issue at all, there's no bleeding, there's no pain, you know, you're going to menopause, don't need surgery, don't need operation, right? If the size is very small and it gives you a lot of symptoms like bleeding all the time and pain all the time, and you can't stop the bleeding, There are multiple ones and very small, and you want to do something for it. And operation is one of them. But does it really need operation? No, change your diet. Diet first, because what causing the fibroids? It definitely, if you put on weight, if you fat, then diet and exercise. Well, of course, if you're bleeding a lot, exercise may not be good for you because you don't have the energy to do it. So diet first. Secondly, when we talk about treatment, Chinese herbs, moxibustion, acupuncture to stop the bleeding. So first you want to stop the bleeding and then try to get rid of the fibroids without treatment. Acupuncture, Chinese herbs, moxibustion. Then if it doesn't work, I'm not saying that I can 100% remove all the fibroids, but if it's not working, then the last thing, operation. Okay? But try it first. Don't go through operation first. And of course, fibroids. I don't know the size. Because the size is so big and you haven't got any signs, and depending on your age as well, there's no need for operation sometimes, depending on the age and symptoms. And what do you want? Do you want to treat fibroids or do you want a baby? And become different. The priority is different. The treatment will be different. Okay. Right. That's it for today. And thank you for joining in. And thank you very much. I'll see you tomorrow morning. And I hope this helped with this topic and talk about it. When it comes to treatment, it's not just the practitioners make the call. It's actually the patient, and you as a practitioner, you need to tell patient what the option will be and what they want. Okay, if the patient suffers from fibroid, they come to you, which means most of the time they want to avoid operation, right? Makes sense. If they don't want to avoid operation, they come to you, it doesn't make sense. They come to you because they want to avoid operation. Then there's a chance to talk to them. What is the process to treat them? And what's the lifestyle to change? Because for the operation, they won't tell them to change lifestyle. I haven't seen any kind or specialist telling the patient that they need to change the lifestyle, they need to manage the stress, they need to change the diet. No, they just operate it. If hysterectomy, then the next thing is hormone replacement, or they just remove the fibroid and that's it. And wait, and that's it. You go home and they grow back again. You need to think the real reason that no one know about where exactly it come from, the fibroids. Okay, so you need to do everything to make everything perfect. Try to be perfect so it doesn't form fibroids again. Thank you, Sunan. Enjoying your presentation. Have a great day. Drive carefully. Pray for us. Thank you for sharing your knowledge. Thank you. Thank you, Veronica. Thank you, Eric. No pain, but period is irregular. Yeah. Alright. No pain, but period is irregular. Again, what do you want? And how big is it? And irregular means it doesn't come on time, but does it cause bleeding, spotting? You can't stop the thing, you know. So, and how big is it, where it is. So this is all the information. I can't give you any advice in here, but I can lead you. You should consider blah 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 thing. Then you make the decision yourself, and the patient make the decision yourself. Okay, and what is the priority things to do? What does the patient want? The patient want to treat the fibroids, or the patient want to have a baby? It's all different things that we need to know, and then we give the advice, give the option to the patient, right? So I don't know what your patient wants, and I don't know of that, so I can't give the best advice for you. All right, thank you very much, and I love you all, and see you tomorrow.